Lead-based paint was banned in 1978, but any homes built before that year can still contain lead-based paint. As it deteriorates, it can create dust and flakes that can be ingested or inhaled, especially by young children. Lead can also be found in older plumbing or certain imported toys or goods. This is why lead is still such a significant concern today. But the good news is, lead exposure is completely preventable. Understanding where there can be possible lead sources in your environment and knowing the steps that you can take to address them is the key to keeping your family safe. There are some indicators that can help you spot potential lead-based paint. One of those indicators is called alligatoring. It's this scaly, cracked pattern of paint that resembles alligator skin. This can be seen on windowsills, door frames, on porches, or on handrails in homes built before 1978. If you spot that alligatoring pattern, it's time to ask some questions and maybe take a closer look. Lead is a potent neurotoxin, and it's harmful to young kids because their bodies and brains are still growing and developing. No amount of lead in the blood is safe, and even a small amount can be very harmful to a child's learning, behavior, and physical development. Children's bodies also absorb more lead than the bodies of adults, and they're just more likely to be exposed to lead because they're often putting their hands and other objects in their mouths. Most children don't show any outward sign of illness, and so a family might not know that their child has been exposed until the damage has already occurred. That's why it's so important for children at risk of lead exposure to get a blood lead test, especially at ages 1 and 2. The earlier that lead exposure is detected, the earlier that exposure source can be identified and safely removed, preventing further exposure and further harm. If you see that alligatoring paint anywhere in your home, you should talk to a healthcare provider about giving your child a blood lead test. That will tell you definitively whether or not your child has been exposed to lead. Now, recognizing risk is the first step in protecting your child from lead exposure, but there are actions around the house that can help further reduce that risk. That includes cleaning floors and surfaces with the wet method, washing children's hands and toys regularly, especially around mealtimes, cooking with and drinking cold tap water only, and making sure that paint is intact and undisturbed. For more information and for additional resources for support, you should visit the Childhood Lead Poisoning Prevention Program website at vdh.virginia.gov/leadsafe.